Hello, everybody, and welcome back to a podcast to answer your questions on addiction, recovery, and mental health by Waismann Method opioid treatment specialists and rapid detox. I'm Dwight Hurst. I'm a clinical mental health counselor as well as the co-host and producer for the program. Today, we've got a regular panel of wonderful experts, as always, and we're really lucky today to be joined by a really exciting guest to share his experience and expertise in the area of addiction. So let me just go around and we'll touch bases on who all is here. First of all, we're joined by Claire Waismann, who's a substance use disorder certified counselor and registered addiction specialist. She's the creator and founder of Waismann Method opioid detox and Domus Retreat aftercare. We're also joined by our program's therapist and clinical expert, David Livingston, who's a licensed marriage and family therapist. And David is a leading expert in the field of the psychological needs connected with addiction, treatment, sobriety. Dr. Michael Lowenstein, our medical director, is also here. He's an internationally recognized expert in rapid anesthesia-assisted detoxification, anesthesiology, pain management, and addiction recovery as well. So welcome, all you regular people, back to the show. Good to see you all again.
Good to see you.
We're also joined today by our friend Richard, who is joining us to talk about his experiences with addiction and treatment, and also to share with us some information about his upcoming memoir, Longlasting Effects, where he's telling his own story of detoxification and working with the Waismann Method and the Domus Retreat. So, Richard, thanks so much for being here.
Oh, thank you so much for having me. It's a true honor to be here with all of you.
Well, you've given us a great honor just by appearing, and appreciate the work that you've put into the things that you work through, but also being here because it means a lot. It means a lot to me. I know it means a lot to the rest of us, and it means a lot to those out there that are going to benefit from hearing your story as well. I thought a good way to start would be just to hand off an opportunity to you to introduce everybody to yourself and your experience, and maybe start out by telling everybody what it was that caused you to first seek out treatment.
Well, I have struggled with addiction for about 15 years at the point where I was basically at my end. And I had, me and my wife had gone through the loss of a stillborn child, and it just kind of threw me back into a cycle of addiction after being clean for a little while. And so, funny enough, and it's not so funny, but I was online, and I was using the internet to try to look for new injection sites because of the excessive amount of needle use that I had with my drug use. And so through looking online, I found opiates.com, and I said to myself, well, they're going to have some good information, I bet, about how I can help myself in this area. And the website popped open, and I started reading about it, and I was shocked. I can't believe I had never heard of this. And I called, and I spoke with somebody who was extremely nice. They explained to me pretty much the procedure and the Domus Retreat and all of those things. And I got back with them, and there I was 3 weeks later. So
talk about the power of SEO, not to be, that sounds silly about it, but that's a great tribute to being able to have a good website name. In this case, that helped you to find treatment when you were not necessarily looking for it. Although it does strike me that you were already seeking out something that was, let's say, medical in nature. You were trying to take some kind of care of yourself within the problem that already existed. And so there's some part of you that maybe, it sounds like, got activated by the opportunity to do something maybe even medically better, if you will, if that sounds like.
Oh, no, absolutely. After reading through everything, I was just shocked. I'm like, this sounds like an actual way out of the cycle that I've just been repeating and repeating and repeating so many times. And, I was initially about a month and a half before I was doing that search online, I had been in a MAT program with methadone, and it was taking a toll on me in ways that I didn't like. And instead of being more responsible and trying to figure out alternatives, I just went back to what I always knew, because that's just how my cycle went. And so I was trying with treatment, but I had just not so great experiences at residential treatment programs in the past, between 30 days and one I was there for 13 months. And none of them really gave me tools to break that cycle. And so, but now I'm here. And so, it's a true testament to the amazing procedure and the Domus Retreat and just everything you guys do.
Yeah. One of the things I noticed, you were kind enough to provide us with a sample. And by the way, very talented writer, which is made it very pleasant to read.
Thank you.
Some of your experiences as well, very, very descriptive. And you talk about a crucial moment in there where you handed heroin to a nurse.
Yeah.
I thought it was very powerful. Could you tell us a little about that?
I am sorry, guys. I am truly sorry. Forgot about that.
Oh, no,
it's for me, Claire. I forwarded all my calls to you just so it would look like it was your calls. No.
Well, I'm sure I'm not the first person that has wanted to take that step and felt ready, truly inside, to surrender the old ways and try to break that cycle and trust the process that was going to happen. But there was still that nagging, well, I don't know if I cannot have my stuff with me. And, my bags were thoroughly searched, and please, nobody ask how I got the stuff there. But I ended up getting it into the hospital with me, and was going to wait until I had my IV line in, and I was going to do that on top of the comfort opiates that are given to stop withdrawal. And, I had a crisis of conscience, or my brain kicked into action for once, or however you want to say it. And I know that I had been offered the opportunity, if I had anything illegal when I came to the hospital, that it was a safe space to be able to give that up. And that stuck with me, and I remembered that. And after I got settled in the hospital room and was having intrusive thoughts about doing that, I asked to speak with the nurse privately, and she was shocked that I wanted to do something so drastic, but very not in a judgmental way, but just like, knowing how dangerous that could be. And she offered to dispose of my drugs for me without any repercussions, and that was really a turning point for myself, and as far as trust goes with medical professionals, and especially revolving around addiction, because a lot of the other treatment centers that I had been to that were just more long-term residential, they were not so kind. And previous times being hospitalized, etc., having an extremely high opiate tolerance, I got treated not so great. I lived in the state of Florida at the time, and they had their own, the pill mill epidemic was going on back then. And so I had a huge distrust for the medical system when it came to addiction. But, that was all changed. So.
Yeah. And that leads a follow-up question I want to pose to everybody, maybe especially Dr. Lowenstein. You can talk about this with medical staff. When you talk about that feeling of a safe space, Richard, and being able to feel vulnerable enough to actually tell someone. And unfortunately, the existence of a treatment program is not enough by itself. You really highlighted the treatment that you received and the feelings that were there, right? Emotionally as well, to be that vulnerable. I wanted to throw that out there to ask everybody, how do we approach that? in order to make an environment that does help people feel that way?
I'll start with that. I think there's several ways that we approach it to make the patients feel comfortable and safe and establish a trusting relationship. One is that when we're treating people that are addicted or dependent on drugs, there's two issues. One is the opiate dependence, which is a medical issue. And so we let the patients know that we're treating them with a medical procedure, because opiate dependence is medical, and we treat them like patients. We don't, there's no judgment. We're not treating like quote addicts. And we really emphasize the fact that, we're caring for them as patients, and they are medical patients. And I think one of the other things we do to establish trust is from the very first time we talk to the patients, we walk them through exactly what's going to happen. A lot of the prospective patients have had bad experiences where they've gone into a treatment center and they've been promised something and then it doesn't happen. And, they're in withdrawal and they're sick and they can't even begin to address the underlying issues because they feel so bad. So we kind of really walk them through. And then once they show up at the front door of the hospital, our staff greets them and gets them to admission and gets them to a room. And it's important that we really deliver on what we promise them as far as, treating them like patients and telling them we're going to keep you comfortable. We're going to make every effort while we're admitting you and doing all the testing. And letting them understand what's going to happen and then delivering on that, from the time they come through the door. And our staff is all very good. The patients are treated like patients, with respect. And we also, I think, listening to what they're saying is important, and listening to their experiences. I think everyone I've treated lately has had the precipitated withdrawal from being given Suboxone or something too soon and putting into withdrawal. So I think it's really important to listen to what the patients are saying and where they're coming from, and then to take care of them appropriately.
Right. That non-judgmentality that you mentioned, Richard, unfortunately, that is something that is missing in many places, even treatment. Oftentimes there is judgment. And you're used to, you can tell me if you found this, but I think you get used to anticipating judgment, right? Whether it's legal or social or, personal judgment and people looking down on the problem.
Oh, no, absolutely. Even when I don't look as colorful and all of those things as I do now, where, my outward appearance might cast some type of stereotype. As soon as anybody finds out that you're struggling with substance use disorder and they're not compassionate about it, it just goes from hi, how are you, to judgment. And especially in other treatment centers I've been to, it was, well, you signed up for this and you're here and you're going to do this and you're going to do that. And that's just how it is. And you definitely don't have a voice, at least not where I went. It just wasn't like that. And so, being explained the procedure, and yes, the staff, everybody from who you see the front door until Jaman over at the Domus Center waves goodbye to you as you're leaving. Everybody's just wonderful, and it helps a lot. It makes taking that step that much easier, in my opinion, or from my experience, rather. So.
If I can intervene here 1 second, I think, and I'm not talking about our treatment per se, I'm talking about treatment period. I think the moment that people in this field, if it is the mental health field, if it's addiction field, if it's the medical field, regardless, people, they are dealing with human beings. You need to start to look at people as individuals. They're not addicts. They are not patients, even. They are individuals. They're individuals of their own histories, their own DNA, their own difficulties, their own anxieties. And as Dr. Lowenstein was saying, I think to feel heard and even understood, not all the time we can understand everything, but we can definitely hear and we can definitely try to understand. And I think that's the moment when things change. on our field, because we treat patients from all over the country, we don't see them. So we are really selling a promise that I will care, that I will do everything in our ability, professional, individual ability, to get you where you need to be. Does it mean that we always can do everything we want to do? No. But I think it's important for the patient to know that we're going to give it our all. And there is no expectations of how, I mean, obviously there is a frame of, respect both ways and behavior. But if you stay on that normal frame, there's no expectation of how you should feel, what you should be, what you should look like. We want to be here. When he says WmD, a lot of patients tell me that as they come in from the hospital to Domus Retreat, they're weak, they're anxious, they are hypersensitive, they don't know what life is going to be without opiates. So there's a lot going on physically and emotionally. But as WmD gets them and say, I'm here, I'm gonna be here and get you where you need to be. At that moment, they feel, he got me. And I think this is what people in this field should be aware of. People have been beaten up quite a bit. It doesn't matter if it was society, if it was themselves beating themselves up. It doesn't matter where it came from. But by the time they still have the strength and the power to seek help, we should extend that hand and that arm and do what needs to get done.
Yeah, and I know that that's important part of the way that you have set up treatment, and also the way that you encourage people is to make sure that a compassionate environment and compassionate treatment is part of that, right?
Yeah.
David, go ahead.
First of all, hi, Richard. How are you?
Good, David. It's great to see you.
Good to see you. And yeah, the judgment that should happen is, as Claire and Dr. Lowenstein pointed out, is we should be judging our ability to help the patients as well as possible. They're vulnerable. They're under our care. They have taken a risk. They don't really know us or really know what to expect. They don't know who we are. And it's a big leap of faith. So rather than, even though we do have a program in the sense that there's a process in which they're going to go through, medically, particularly in the beginning. And then the aftercare at once they get to Domus is set up in such a way that really, because everything happens so fast at the hospital and the opioids are taken away from the receptor so quickly, it's just helping them feel better, helping them sleep, helping them to get regulated. And part of my job, especially in the very beginning, is just to help orient everybody to what the process is and how they will get better. So helping them sleep, helping them eat, sort of, medications that can diminish any types of symptoms that are happening. So, and as people feel oriented, they feel like the way forward, you're interested in their care and feeling better. It helps them feel regulated much quicker.
Yeah. I wonder, Richard, could you tell us a little bit about what role counseling has played in starting your treatment and then in aftercare from that?
Yeah, absolutely. I made sure to write it down because the conversation that David and I had was quite profound. It was definitely impactful for me, and so I just wanted to find it here. Here we go. And I believe this is my recollection of it, David, when we had our first counseling session there, was that I explained to you some of my previous system trauma from being involved with drugs and getting arrested, the loss of my son, and past negative experiences with treatment centers. And you just you listened with such compassion. And so what I recall you saying to me was that you are worth so much as a person, more than the cost of the rapid detox and the time at Domus, more than the total sum of that you would have spent on drugs, more than gold. And to me, that that's the complete opposite of everything I was ever told, even at other treatment centers. And we talked about not being chemically bound to the drug anymore. As you just said, the receptors get flushed, and that I have the choice to put them back in my body or not. And, that was just so encouraging. And I remember that to this day. I don't think I could ever forget that. It was impactful. And, and then post Domus care, I had already had a therapist who I had been seeing for a little while for grief. And we just weren't a good fit. The modalities of therapy that she used weren't really helpful. And I continued to see her for a while, and I ended up finding a new therapist who used more clinically based modalities. And it's crucial. It's definitely one of the notes I have here is that when you're going to prepare, once you've committed and you're going to go, and you're going to do the rapid detox and go to Domus, part of the planning should be, setting up a good support system, if you don't already have one back home, as far as not just mental health professionals, but competent and compassionate mental health professionals. Because, I've heard countless stories of people, they have, one bad therapist and they're turned off from therapy forever. And, it's so worth it to have somebody who can give you a different perspective than the one that you are having from intrusive thoughts or what have you. So, I look forward to going to see my therapist. I even look forward to going and talking to my psychiatrist, even though it's just medications and stuff. He offers a second type of point of view from a clinical perspective that I appreciate. So, I am grateful for the support system that I have. And that's something I definitely encourage anybody, period. But, especially when you're going to be taking such a huge leap out of the darkness, so to speak, it's great to have support.
Very much so. It's such an important part to not only find someone who uses modalities, like you said, but you also mentioned one of the really key parts of therapy, which is having a personal connection and feeling like, you're a good fit, for lack of a better, there's tons of research that shows that both of those are important, but having a good fit is even a little more important to make sure that you feel that way. Yeah,
definitely.
And I love the encouragement that you're giving people to say, if something's not working, to switch that up, right? And to give it a different try instead of just giving up.
Absolutely. Well, and that was something that through the compassion and the comfort and what had been every other time, what should have been in my mind a tough time. I have detoxed in the bottom of a jail cell from taking 1,500 milligrams of oxycodone every day for years with no medication. And that is scary and really awful and lasts for weeks. And, I just never felt like I had a voice. And so being your own advocate is a huge deal when it comes to your medical care. That's your life, so I try to just be my own advocate, and I try to encourage other people to advocate for themselves properly as well, because if you don't say something, there's a good chance nobody's going to say something. So
Yeah. Is if when we use a term like a treatment team approach, the most important part of that treatment team is the person who's getting the treatment, which is you. It sounds like self-perception and the feelings of self-worth and confidence were a big part. How did you see those evolving throughout this process for you?
So, basically after I had left the medication-assisted treatment of the methadone clinic, and had to go back to using, illicit opiates, my self-esteem was already rather low. It had been just from years of thinking that I was going to get it this time or whatever, and repeating the cycle. And, I was basically at the point where I just wished that I could just poof, not exist. So I didn't hurt all the people that loved me, but I wouldn't be what I perceived myself to be as a burden on them. And so, that's kind of where I was at. Besides dealing with grief and other things like that, my self-esteem was just really low. And talking to you, David, helped that a lot from the get-go when I got there. And now I am to a point where I can say I'm proud of myself. I'm proud of who I am. The path is not easy, just because, I had a wonderfully positive experience at Domus, and I had made sure to titrate myself down on how much opiates I was using before I went, to try to make the medical procedure easier, because I have gone into precipitated withdrawals, as Dr. Lowenstein was talking about. And, it's quite unpleasant. And so I knew that wouldn't happen, but I figured that the least I had in my system, the better. And so, I just because I had a really good experience does not necessarily mean that, when you get back, it's all just a cakewalk. I definitely rode that wave of confidence and joy and disbelief, honestly, for a couple of weeks after I got home. And, the first stressor that came along, I had to really take a step back and say, okay, this is not who you are. This is a situation that you are dealing with. And, make sure that you don't lose sight of that. It's kind of how I got myself through. And boundaries, so important. I had to learn very quickly to put boundaries up around friends and places, people, places, and things is a common saying. But truly, that's like the one thing I wish I would have done, which I can now tell anybody who might be listening, who might be taking that step themselves. Say your goodbyes if they're necessary, but make sure you get rid of those people's contact information. It's just not worth having around when you get back. Intrusive thoughts are just thoughts, but they're powerful. And moments of weakness can happen, and it's just best not to have that just hanging around. But it took many years for my mental health to kind of reach a point of where I'm at now, as far as I am important as a person, and the mistakes of the past do not define my future. So,
it's a good point. Very good point.
Yes.
I'm curious, David, some of your thoughts about that, the evolution of the way people view themselves, and really kind of the expectations we place on ourselves, and how important that is in the therapy process.
Well, we have expectations. We all do, and we need them. I think, like Richard's saying, it's just, and Claire and Dr. Lowenstein, it's just about really orienting ourselves to what's healthy and what isn't, and what we truly need. As I like to say, needs drive everything. So when we're paying attention to what we need, our tensions go down. We tend to relax more. We tend to feel more within ourselves. And if if you're feeling vulnerable and you need to feel safer, yeah, get rid of anybody who's going to be make you feel more vulnerable. So you listen to those needs. Look, from the moment, Richard, you were in the hospital, you made a profound decision about, which direction your life was going to go. I mean, that's what I read when I was reading your memoir. I mean, that really stuck out. And I think that moment of honesty where you were really just, and there's no more profound decision than that. And I think that moment in your life was a true sort of shift in who you are and what you wanted, and also having gone through the loss of your son, and you were deciding in that moment how much you were willing to bear of being alive, because it's hard to be alive, and we all need each other to bear that with us. I see that as part of what in our own way we try to do. Dr. Lowenstein does it in his way at the hospital by working with the patient so much. Claire does it in the whole way she organizes everything and gets them through. And I do it in my way. And maybe we even do some of it with Dwight's help on this podcast. But, we all suffer. The idea that there's no suffering in this life is and I think that when that's established, when people know that, it's not a big deal for someone to come through who's having their own suffering, and you just help them with it.
Very much so. Touching on the issue there, as you're saying that, Dave, the word that comes to my mind is resiliency, right? It's not so much, we can't avoid suffering and difficulty, but we can try to work on increasing our resiliency towards it and maintaining something that helps us be resilient to the dangerous effects of those things. I kind of want to open that up for everybody to hear a little bit about what anyone's feelings are about the concept of resiliency, how important it is, and how we have it and how we practice that.
I think, Dwight, if I can say something here, one of the important aspects of recovery that Richard discussed after detoxification is the multifaceted aspect. So as he said, is from his music that he found, to guide his feelings towards a healthy path, from his psychiatrist. I think we're in the Mental Health Awareness Month is extremely important for people to understand that people that go to a psychiatrist have a chemical imbalance. That's what it is. They're not crazy. They're not different. They are not lesser than. They have a chemical imbalance. Like, people can have, issues with sugar. People can have issues, with other physical issues that your body doesn't produce. So as the chemistry of our brain. He has his therapist that deal with his emotions and the support that he has around him, and whatever he chose to do as a productive life in his life. So you can't depend on one thing to fix everything. It's not going to happen. And I think that's the issue that we have spoke about on other podcasts about rehab, or about centers that promise you by the time you leave, your life is going to be great. You're going to be off drugs and life is going to be colorful and you're going to feel like you felt before you start with addiction. This is not life. And this is not being a human being. Now, there is so many facets of our life that needs constant working, that needs constant effort. And not to make it, a exhausting effort. Sometimes it's a productive effort that makes us feel good every level we reach. But that continues as we get older, and the needs are different, the difficulties are different, and our efforts will be different. Mm-hmm. But I think Richard, did that first part of getting the physical dependence behind him, but then giving him credit. He kept looking for the different facets of his life that would make his life richer. And I think when we make our lives richer, it makes us want to live more through the difficult times.
Very much so.
Yes.
Yeah, and if I could just say something in response to what you were just talking about, Claire, and I think it was something that was the topic of another podcast, and it's something that has helped me tremendously, especially because I was dealing with such severe issues with self-esteem, and that is self-forgiveness, and not stigmatizing yourself from getting more help after you've gone through the process that you perceive to be the one that's going to be the end of it all, when really the process is the beginning of all of it. And but self-forgiveness is a huge thing for me, at least anyway, because without that, I wouldn't see a psychiatrist because I don't want to take drugs, and I would stigmatize myself, and that doesn't help me. And so yeah, that's super important in my opinion.
Very much so. Well, Richard, can you tell us a little bit about how are your current practices and the things you do to manage your health now? How has that evolved? That's different than when you first got out from the detox process.
Yeah, so it's been a few years, and so I will say the first 6 months were rather rough. I have never put an illicit opiate back into my body since I left Domus, period. No, I mean, not while I was there either, but not since I left. And, but there were times of, oh, well, it's not an opiate. I guess I can just do that a little bit, whatever, with these guys, because that's what they're doing. And it was an eye-opener for me that I needed to have better boundaries around what I do with my time. And, I'm a stay-at-home dad right now. And so I have a bit of time that could be used wisely or squandered. And so, for me, I do a lot of writing. I'm working on the memoir. And I started off with poetry because it was a good outlet for a lot of feelings that I had, because part of I almost like to call it reanimation of your soul that happens once all of those opioids are stripped from the receptors is having emotions again. Because for me, opiates were my emotional off button, so to speak. And to feel again, to be human again, was not the easiest. And so, boundaries were very important, and, advocating for myself to find a different therapist who we worked better together. And I've made more progress with her in a shorter period of time than I did before with the other therapist. And, I also, I got a few guitars behind me. I picked up playing the guitar last year because I just wanted something that would be beneficial to my mental health. It's definitely a form of self-care for me. And so, besides the cooking and cleaning and all that kind of stuff that I do, I spend a lot of time writing and playing music and stuff like that. And, I want to do more, but I also am not trying to put strict, demands on myself as far as, oh, well, you didn't go and ride your bike 10 miles today or whatever, just because I have found that, you start treating yourself badly in your mind, and with intrusive thoughts, letting them just come in and then running with them, it can be rather triggering until you can kind of realize that intrusive thoughts are just that, intrusive thoughts. But in the beginning, intrusive thoughts led to impulsive actions, and that was just that was not great. And so I'm really grateful to have been with enough support and be able to move past that part of learning what is acceptable for me, what is not acceptable for me, and what I want to do as far as moving forward in my life, just to, like I said, be somebody that I can feel proud of myself for who I am.
There's a lot to feel proud of. I think that it's very impressive, the things that you're going through. And also, I just on a personal level, and I know everybody here has this feeling, that I appreciate your own transparency, that, you know, those of us that we have whatever we're good at in our expertise, and we can come on and talk about treatment and things. You know, we can do that every couple weeks when we do. But to have you come on and share your own experience with people, for everybody that's out there that can hear this and see this, I think you're really giving back and helping so many people just by doing that. And I want to thank you for that as well.
Yes.
Yes,
Oh,
thank
you all. You know, it truly did change my life, and you all are part of that. And you know, and even like I said, you know, Dwight, I listened to and watched rather some podcasts before joining with you guys, and you know, you guys are doing good work with that too. And but I openly now speak with whoever wants to hear, or if I feel like would benefit from hearing my story, because it is surprising. Well, actually, I don't think it's so surprising, unfortunately, with how things have gotten with fentanyl and all of the other ways that people in different communities just see suffering going on with drugs. And you know, a success story. I've got it written down here. You know, I finally realized I'm not going to be a statistic. I'm not going to be an accidental overdose statistic. I'm not going to be a convict. I am going to be a success story, as far as doing the hard work, because I have support, and I had a fresh start after leaving Domus in my mind. And so, you know, I get into conversations with all sorts of strangers or people that I don't know quite well. And a lot of them are shocked that this treatment exists and they don't know about it. And I make sure to hurriedly get something out so that I can write down the information or have them put it in their phone. And I tell them, I look them square in the eye and I tell them, if you know anybody who is suffering from, you know, substance use disorders with opiates, you should look into this, or at least suggest to them that they look into it, because, you know, like I said, I went through many other outlets of not great care before I found real treatment with you guys. And so, you know, this isn't a paid advertisement, no, but really it's the least I can do to be here and be able to be as transparent as I can, just because I would love to know that somebody was on the fence, considering it, scared, not quite sure how it would turn out, and they heard my story, or when I eventually can get this memoir together, read my book, and they say, oh, wow, I just didn't know that that was an option. And it helps them push their life forward to a new space. So, you know, it's definitely my pleasure.
Wonderful.
Richard, now let me just say thank you. I don't think any of us could receive a better compliment than what you just said. And
No.
And I'm so glad. And as much as I like reading what you're writing, listening to you and the authenticity in which you speak, and you're so articulate, and I can, you know, it's just, you are an active dynamic. It's as if you came out of the ashes and you're, you know, flying, and I can see it, I can hear it. That's the hope. I mean, that truly is the hope. It's, you know, so it's, I know for all of us, you know, you coming on here and being able to express this, or at least for me, it's fantastic. Thank you.
Thank you, David.
Definitely a story of hope and success for many, many people that are out there now seeking that at this point.
Yeah, the only thing that's a little troubling is, after seeing your shirt and your background, I'm going to have to do some updating.
You know, I actually saw everybody else's background and was like, oh boy, I guess I should have used the digital background. No,
No, we got some livening up to do.
Right. Or the
Your-
boring ones.
Your background is a room that I just want to go hang out in, actually,
Exactly.
Richard. So that's very welcoming.
And
Good.
Richard, thank you. And we can't do what we do until the patients show up at our door. So while everybody that we treat, or they all have opiate dependence as a common issue, everyone's extremely unique, and your stories will just resonate with a lot of people in ways that you may not even be aware of. And so just having you out there and telling your story, I think that's, we can't do our good until people get here. So I appreciate you being willing to tell your story, and I'm sure you're going to, a lot of people are going to hear what you have to say and say, wow, that could help me.
I appreciate all of you guys. It only works if we work together, right? And so, and also, I obviously I'm not going to share everything that I went through in my entire opiate dependence phase, but I went through the ringer for sure. I'm grateful that I am even alive. And so if I could potentially help somebody have their own aha moment of, you know what, this really isn't fun anymore. I don't even know when this was fun, but I can't remember. And I'm done. And you're telling me I can have a clean slate, chemically, so to speak, from opiates. And that's the true power of the rapid detox, and then going to such a wonderful environment like Domus, because yes, you're vulnerable, and you are, dissociated from your emotions, which are coming back to you. And, but I started to feel not like myself, but more like a different, better version of me by the time I had left. And that also is something that even when things got to be not so great, as far as just learning to set boundaries and stuff, so I didn't find myself in situations I wanted to avoid, remembering that you went through all this to get that beautiful slate of freedom from opioid use disorder, and you don't want to throw that away if you can at all help it, possibly. And so yeah.
Very much. Thank you. And as Richard said, we're not we're not just out here plugging ourselves, although we are very proud of the work we do at Waismann, both here on the podcast and the treatment. But hopefully, one of the things we always hope is that those out there who we may not run into personally, that you will use the elements of treatment that we talk about in how you select your own treatment and how you self-advocate as well. So that's once again always a big part of what we do. So thank you everyone for being here today. Also, speaking of meeting any of you out there personally, we want to hear from you. We want to know your questions. We live on questions here. We live on stories as well. So if you have recommendations of topics and themes and things that you would like to see us cover and talk about, you can reach out to us at info@opiates.com, or do like Richard did, go to opiates.com. It's a great starting place. You can contact us through there. There's lots of information. You can hear and see our podcasts and recordings, and also get into our social media. One of the other ways you can help people out there is by liking, sharing, and passing along good information about addiction to those that are out there. As I always say, if you wonder if you know people who need this, just assume that you do, because you do. There are people in your life who need this information. This show is, of course, a production of Waismann Method opioid treatment specialists and Rapid Detox. Our music for the intro is the song Medical by Clean Mind Sounds. And I want to say for Claire, David, Dr. Lowenstein, myself, and Richard, welcome, and glad that you were here today too. I want to pass that along to everyone to remember to always ask questions, because when you ask questions, you can find answers. And when you find answers, you can find hope. We'll be back with you again soon. Bye-bye for now.